It was just like entering a Danish classroom, because at the beginning no one wanted to sit in front and everyone was very quiet, but it took a few hours, then everyone was engaging, and it was very nice to see that there were people who had like 2 days of experience of caregiving, and there was people who had like 10, 12 years of experience of caregiving. But they blended very much, and they all respected each other. But also they have, even though you've not been in the caregiving for that long, you still have some of the same experiences. But they were all very collaborative and caring for each other. That was very nice to see. I think you have to be open to reflect on your own competences and how you are in the caring role. So sometimes we have very good relations with patients or clients, and sometimes we know that we could have done better. But it's being open and also reflecting on what went well and what did not went that well. So having that open mind to reflect on one's caregiving competence, I think that's very important. And in this course, we did that together, and it was nice to see that the participants were also not afraid of sharing these moments where it's very difficult and where you have challenges. You have to be open to that, and I think this is what really help us to develop caregiving skills. It's not very fancy. It's just always remember that we are different as people. We have different values, we have different views of things, both person to person, but also in our families. So I think this is actually the most important topic, and so it's not something very fancy. We know that, but we often forget it in our daily work. I've only met very friendly and very open people, so this is definitely my experience so far. I think that it's coming from a very different country, a very different society, culture, and so on. You try to imagine how it will be, but you never really know. So trying to align, you use a lot of strength trying to align as it goes on. So it's also something that you have to practice. So if I had to do this course again next week, I hope I would be better prepared for it. Yeah. I think you have to be very careful in who you hire to be a caregiver. We often think that being a caregiver, being empathic, taking care of other people's are a very simple task, but it is not. So we are all born with, and we are all raised with, some of the simple values like taking care of each other, but doing this professionally and doing it towards people and families who meet illnesses or old age is actually a very complex matter. So carefully picking, but I can see that you are already starting to do that, so I'm sure I have confidence in your future. I think it's very innovative, and it's very much looking into the future that HLL has taken this initiative. I think that soft skill is a very important part of caregiving. It's not something that we often discuss. It's much easier to talk about the hard skills, but it's difficult to take that step. You don't see the benefits right away. It takes some time to see the benefits, but I think this is a very important step. So I'd like to thank the HCCL for taking this initiative. It's very innovative thinking. It's very much looking into the future. This is a very important part of caregiving. So it's not a topic that we often discuss, because the hard skills are those that we often focus on. It's much easier to measure, and it takes a longer time to implement soft skills. But I think it's an important step. Friendly people, fantastic food, and I was told that it was going to rain all the time. It's been sunshine almost all of the days. It's been a really nice experience.